The next session actually provides the name for the entire meeting. It's the promise of climate solutions benefiting health and equity. And our moderator for the session is Jonathan Patz, who is known to many of you, if not all of you. He's the professor and John P. Holton Chair of Health and the Environment at the University of Wisconsin-Madison, where he also directs the Global Health Institute. Dr. Patz co-chaired the health report for the first congressionally mandated U.S. national assessment on climate change, and for 15 years served as lead author for the United Nations Intergovernmental Panel on Climate Change, the organization that shared the 2007 Nobel Peace Prize. Professor Patz has taught and conducted research on the health effects of climate change for more than 20 years. He has countless awards, has published over 100 peer-reviewed studies and several textbooks on the subject, and is one of the foremost experts on climate and health that we are lucky to have amongst us. So welcome, Dr. Patz.
Well, Mona, thank you for that wonderful introduction. Far longer than I'm going to introduce the other speakers. Just a reminder, everyone has their bio sketches in the fabulous program that's available online. So Colin, if I could have the first slide, I'll just say that I wanted to thank VJ for just setting the tone beautifully. Fantastic communication and great work. And I will just, if you can go back to the beginning there, just say that.
Sorry, keep going, just 1 second, John.
Okay, so we all know, Dr. LeMay pointed out all of the risks and what the costs are for the United States. And so we are going to be focusing not on the crisis and the risks from climate change, but we're going to be focusing on these benefits, and that could climate change, actually the actions to mitigate climate change, could they be free or a net benefit? So next slide, please. And so you all know these, and VJ went over those. So you've all memorized those. So let's move on to these benefits. So you can see that we've been talking about this for a while now, that solving the climate crisis could be our greatest opportunity. And that's what this panel will focus on. Next slide, please. And if we just look at the three sectors to the right of the dotted yellow line, they amount to enormous benefits. We are in this panel also going to be talking about buildings, but I just want to, because we're not going to talk about health benefits of air pollution with the panelists, I'm going to just dive into that one sector. Next slide, please. So actions on climate change. These are, air pollution. There's a new study that shows, Colin, are you in the slide presentation mode? This is supposed to be animated, but if it's PDF, it's fine. I can just,
yeah, sorry.
Okay, so the energy sector, 8.7 million deaths prematurely because of air pollution around the world. Because we have an intense, energy-intense diet, especially with too much red meat in the diet. If we were to get to the universally healthy reference diet, which is one that you all know, very little meat and lots of fruits and vegetables, that's 11 million premature deaths avoided every year. And in the transportation sector, because of sedentary lifestyles, and we had a wonderful panel just before the break, almost 4 million premature deaths a year. That's, if you add those up, that's almost half of all premature deaths annually. Next slide. So if you think about the energy sector, there are tremendous benefits to, if we get to clean energy, we all know how PM 2.5 kills so many people, over 60,000 Americans every year. And there's a cost, right? A cost to clean energy, a cost to renewables. But compared to the health benefits of reduced air pollution, they're very small. And as VJ talked about, a ratio of 30 to 1 benefits to investments for clean air, it's incredible. But it might even be better when you think about the plummeting costs of renewable energies. Look at solar's dropped 99% in the last few decades. And for the first time in history, the cheapest way to generate electricity without any subsidies is now with renewables and batteries. Next slide, which will be my last slide. There was a study from the Lancet Countdown looking at 9 countries, the 9 countries that, China, India, the US, and others that represent 50% of the world's population and 70% of emissions. If those 9 countries were to meet their Paris Agreement and reduce emissions, the health co-benefits, especially from reduced air pollution, would equate to 1.6 million fewer deaths because of improved air quality, 6.4 million deaths avoided from improved diets, and 2 million deaths avoided from cities designed for people instead of the automobile to increase physical activity. So unbelievable opportunities. And in the United States, the low carbon energy would save 1 million Americans and would offset 40% of investment costs. So it's a no-brainer. So my last slide is to introduce our distinguished panel. And Colin, correct me if I'm wrong on this order, but we have first Ellen, or do we have Raychel first?
Yeah, I have Ellen first.
Ellen first. Okay, so Ellen Tohn is going to be talking about indoor environment, followed by Raychel Santo from the Johns Hopkins Center for a Livable Future. And then wrapping it up is Professor and Dean Emeritus Howard Frumkin, also past director of the CDC National Center for Environmental Health. So we'll save time for questions at the end, and then we go into breakout groups. Okay, so over to you, Ellen.
Great. Thanks, Jonathan. So it's my job to go from the macro a little bit into the micro and talk about solutions and what the health benefits are of the solutions, not just the health consequences of inaction. Next. I'm going to try to make 3 main points, and I hope I can leave you with those. So they are that some of the solutions that are on the table that are ready to go, that we can deploy right now, will improve health. And I'm going to, in my 10 minutes, I'm going to talk about 3. One is about reducing the cost of energy at the household level with fuel assistance. The other is not just making it easier for the people to pay their bills and addressing a social determinant of health, but actually fixing the home environment and what that does in the indoor environment and what we know about the health consequences. And then, as many of you know, in the climate space, one of the solutions we talk a lot about is electrification. And I wanted to dial in a little onto gas stoves. Next. So first, let me just, and you can talk a little bit about a wonderful study that's done by Debbie Frank at Children's Health Watch. And this was a study, many sites, over 7,000 kids, that looked at young children 0 to 3 who received fuel assistance compared to the children who are similar age group that did not get fuel assistance. And the consequences, you can hit the next 2 buttons, are that in the children whose families got fuel assistance, we helped reduce their fuel costs. They were healthier. They're less likely to be underweight for age or length, and you all know the consequences of that as docs. And while they went to the hospital for colds and illnesses much, there was a significant reduction in acute hospital stays that required admission after visiting the ER. So what we know from this study is that if we can reduce fuel costs for low-income families, those are the families that qualify for fuel assistance, we see improvements in child health. Next. So one of the ways that you can get that reduction in fuel costs is to reduce their bills, but another way to do it is to change the physical environment, to do what we would call weatherization or energy conservation or energy efficiency measures. So in a couple of studies that looked at this that I had the pleasure to be involved in, one with DOE and one for a national nonprofit, we looked at all the studies, this was in 2006, of energy efficiency, and we tried to assess what were the health benefits of that energy efficiency work. And most of these studies were really in low-income, single-family homes, I would say. And what you see here is a whole range of health improvements from this type of energy efficiency work that are in the respiratory category, and the italics and the asterisks. There were some mixed results on asthma, but overall positive. A bunch of other health improvements. We see quite a bit on overall health and mental health as we reduce bills and make homes more livable. And then several of the studies also looked at, emergency department visits or hospitalizations and indoor environmental conditions. So what is this work that we're talking about with weatherization next? So this is what we do when we do energy efficiency and weatherization. And I would just say, I was thinking about this talk, and I started some of my career at EPA looking at health benefits of looking at lead poisoning, and then went on to look at asthma. And for the last couple of years, I've really been thinking about energy efficiency. So I've spent a lot of time with folks crawling around homes and making them better. So this is what we do. We insulate and air seal, we put in insulation, we seal up holes and cracks, we fix heating systems that aren't functioning well or replace them. Most of the energy efficiency programs are now adding ventilation as we make homes tighter and venting devices that create moisture. And in some programs, they're looking at efficient cooking appliances or switching out gas to electric. And the consequences of those actions are the columns in the blue, with improvements in indoor air conditions, temperature, relative humidity, and a bunch of pollutants, moisture, mold, particulates. You guys can see the list there, and lower bills. That's our social determinant of health. And you can see in orange a lot of the things I just went through in the previous slide, but I wanted to dial into what we're actually doing in the home. Next. So what do we see if we dive into not just the categories of health improvements that we're able to observe, but what's the magnitude of the improvement? So in single family homes, there was a very large study of the National Energy Efficiency Program called Weatherization, which is funded at the Department of Energy. And that showed 12% fewer asthma emergency department visits and a reduction in cold symptoms that persisted. And they were able to document fewer asthma triggers. As most of you are aware, we know that conditions in the home are more likely to trigger asthma attacks. And they were able to document reductions in moisture, mold, cockroaches, and mice. And then I'll go into this study in a couple more slides, a study that, so in that national study, they just studied anyone who came to the energy efficiency program. They weren't high-risk asthmatics, they weren't prone to being sick, although it's a low-income program, so we see more health risks. The study that I'll talk about in a subsequent slide really focused on kids with asthma that was out of control. I want to jump to the third bullet. Just a more recent study looked at multifamily housing and energy efficiency. And there they actually didn't see as many improvements in asthma. And again, these are just buildings that are enrolled in energy efficiency and low-income programs. But they did see fewer arthritis symptoms and fewer urgent care visits due to cold. And then across many, many studies, when we survey people about general health, pre and post weatherization, we see substantial improvements in mental health. The 48% reduction in poor mental health is from the large national study that was done for the weatherization program of over 500 respondents. Similar improvements in overall physical health when people are asked to rate their health on a scale of 1 to 5. So the study I want to dive into is, this was a study that looked at high-risk asthmatic children, asthma out of control. Half the group got a community health worker visit. You're familiar with that model. And half got the community health worker plus weatherization. Next. And what we can see is the group that got the weatherization saw, remember that's the bar in green, saw a greater reduction in mold and moisture than the families that just got the community health worker intervention, which is a 3 to 5 visit protocol. Next. And when we look at asthma that's that's better controlled, where asthma is no longer out of control, is measured by an ACT score, you can see that 48% of the children went from out of control to better controlled, but that went up to 71% for the group that got not just the CHW, but also the weatherization. So we can isolate the benefit of the weatherization as the 23% added benefit. Next. So if we move on from just energy efficiency and we look at what if we did not just energy efficiency, but a bigger green rehab. This is a study in Boston Public Housing, compared a building that went through a green renovation with energy efficiency and a few other things compared to another building right next to it that had not done it. And you can see significant reductions in indoor air quality and PM and NOx. They saw reductions in all of these health outcomes. You can again see respiratory being focused here with asthma symptoms and hospitalizations, and significant reductions in missed school. This also worked for their bottom line. They ended up saving a fair amount of money every year as a result of the intervention. And then in terms of thermal comfort, overall improvement, although there were some complaints about cold and some spot heating, and sleep, definitely improvements in sleep. Next. So just going on to gas stoves, we can see, perfect. We know when we cook, we make particulate matter. That's what we're using, gas or electric. And with a gas stove, we're also creating nitrogen dioxide and several other the pollutants here, carbon monoxide and formaldehydes. I want to dive into NOx for a sec. Next. And I want to, you all know we spend more time inside, the levels of pollutants are higher inside, but just homes with gas stoves have between 50 and 400% higher NO2 emissions than homes with electric stoves. So well documented. There's a terrific report from Rocky Mountain Institute with Physicians for Greater Responsibility. PSR of Greater Boston just had a wonderful report of this. Next. And I want to look at this Yale study for a brief moment, which is, you can see here they were able, this is a study that has a lot of kids in it. It's over 1,000 kids in Massachusetts and Connecticut, 1,300 kids. And you can see the risk of asthma, what's the odds ratio of having severe asthma attacks? And you can see with an electric stove, it's the amount of NOx we're seeing is 9 parts per billion. And those levels go up significantly of a gas stove and a gas stove with a pilot light. And as we go up above 9 parts per billion, we see substantial increase in the odds ratio for severe asthma. So for all of us about to replace our stoves, I would encourage you to remove the gas one and try electric and think about induction. Next. So what can you do when you go meet with congressional or state officials? At a federal level, I would always support added funds which are in the administration's budget for the fuel assistance program and weatherization. And the new DOE staff are talking about adding funds for health and safety to the weatherization energy efficiency funds. They've limited that to about 10%, and they're talking about increasing that. Also money for public housing to do the kind of green rehab that I just talked about. Sorry, guys, for the background noise that I just talked about with the Boston Housing Authority project. And then the American Jobs Act has a ton in there for energy efficiency and particularly retrofitting affordable housing. Hope for Homes is something in the House that will have rebates for energy efficiency. And at the state level, I would just encourage you, this is probably a space that you may not have participated in, is to get involved in utility planning. There's always a 3-year plan for how we spend utility dollars, and ensuring that those funds support energy efficiency in low-income households would be my final pitch to you. And that's something you could do at the state level. All right, I think I've used my 10 minutes.
Ellen, thanks very much for that. We're going to move on to Raychel Santo at the Johns Hopkins Center for a Livable Future. Raychel.
Thank you, Dr. Patz. Thank you, Ellen. Thanks for having me today. Today, we're going to talk about how changing what we eat and how we produce it is an essential climate solution that can bring both individual and public health benefits. Next slide. Specifically, we're going to talk about the urgency of addressing the climate impacts of our agriculture and food system, ways to reduce food and agriculture related emissions, and health benefits of dietary shifts. Next slide. Next slide, please. Thanks. In 2015, my colleagues and I reviewed the scientific literature on how food and agriculture emissions relate to the climate mitigation targets set in the Paris Agreement. This figure summarizes the findings from one study in Nature Climate Change, but several other studies have come to very similar conclusions. The orange segment on the far left represents agriculture-related emissions in 2010, including emissions related to land use change associated with agriculture, such as deforestation. And then the yellow segment above it represents 2010 emissions from all other sectors. Now, on the right are agriculture and land use emissions projected to 2050 if global meat and dairy intake continues to rise, as is projected by population growth and GDP projections. Next. This red dotted line right here is the threshold we cannot cross if we hope to meet our goal of staying below 2 degrees Celsius global temperature rise. If it's even lower if we consider the more ambitious and recommended 1.5 degree target. Please take a moment to let this sink in. Emissions from agriculture in 2050 are projected to eat up almost our entire global greenhouse gas budget. And we also need to fit emissions from all other sectors below this line. In other words, we need urgent and dramatic shifts across all sectors, including an urgent shift in our agriculture and food-related emissions to have any hope of staying below this threshold. Next slide. So now what can we do? There are several ways to address food system-related emissions. On the one hand, we can focus on reducing emissions, such as by shifting towards plant-based diets or plant-rich diets, reducing wasted food, and improving agricultural practices, such as by reducing the use of synthetic fertilizers, better manure management, certain feed additives, or improving efficiencies in production. On the other hand, we can also create or enhance carbon sinks that remove or sequester greenhouse gases from the atmosphere on managed forests, croplands, or pastures. Most experts recognize that none of these represent a single silver bullet solution to addressing food systems' contributions to climate change, but we will likely require elements of all of these approaches. Next slide. The climate mitigation organization, Project Drawdown, recently published a very useful report highlighting the importance of both immediate emissions reduction from the sector and regenerative style agricultural practices that sequester carbon. It also examined some of the key differences between both of these approaches, including the timeline and reversibility of impact. A significant debate going on right now in both the academic and policy community relates to how carbon sequestration is not necessarily permanent. The potential to sequester carbon in soils depends on different soil and climate conditions, and it can slow down after a few decades, and it can also be reversed if, for example, a farm returns to poor grazing practices or tilling, or if a severe drought or flood happens, which we know is becoming more common due to climate change. This doesn't mean that regenerative agricultural systems aren't beneficial, especially because they can provide other benefits to soils and to local environments. But it's important to recognize that we can't depend solely on this as our food system's climate solution, even if it's the more politically saleable one. And for the rest of this presentation, I'm going to focus on the emissions reduction side of the equation. So next slide. Back to this figure that we were talking about. One study found that if we adopted a healthy diet in which red meat was limited to about 2 3-ounce portions per week, poultry to 1 3-ounce portion per day, along with levels of dairy, eggs, sugars, and oils that are recommended by health organizations, we could reduce emissions by a healthy chunk. Please hit click. And that, along with cutting
electric stovetop.
food waste in half, would reduce overall projected emissions to be closer in line with where they currently are in proportion to other sectors.
Please mute yourselves.
The key take-home point here is that if current trends in meat intake continue, we will more than likely exceed the 2 degrees Celsius global temperature rise. Next slide. So why are such substantial reductions in meat and dairy consumption in particular necessary? Well, in general, animal foods, which are grouped together on the right here, if you could please click, have been found to be orders of magnitude more greenhouse gas intensive to produce than plant foods shown on the left. Beef, lamb, mutton, goat meat, and shrimp and prawns have the highest emissions per serving. Next slide. Without getting into the weeds, there are also some climate-friendly animal foods like edible insects, bivalve mollusks such as oysters, and low food chain fish or forage fish like sardines and anchovies. Next slide. You might also be wondering about the impact of beef in particular. As you can see, the range is really high or quite large, and there are many claims about certain forms of cattle production being part of the climate solution. Next slide. The short answer is it's complicated. Under certain well-managed conditions, pasture-raised or regenerative agricultural systems and cattle production systems in particular that are depicted at right can have a lower greenhouse gas footprint than feedlot finished cattle at the left. And this is because of carbon sequestration, as we talked about, which can actually offset the otherwise high methane emissions from the cattle. The challenge is that not all grazing systems are created equal, and continuous grazing operations, as opposed to rotational grazing, may in some cases have a higher greenhouse gas footprint per pound of output than feedlot finished systems. There are many factors to consider in this, including the starting level of soil degradation, climate conditions, and the potential limitations of reversibility I mentioned before. The science is still evolving in this issue, but it's important to remember that either way, we're still looking at a major source of greenhouse gas emissions, one that is an orders of magnitude higher than most plant foods. The next slide. It's also important to consider the big picture beyond just greenhouse gas emissions. High rates of meat consumption have been fueled by the rise of industrial food animal production over the past 70 years. The vast majority of animal foods available in the US today come from these operations, which can have thousands of pigs or tens or even hundreds of thousands of chickens in one operation. A large body of evidence has documented the public health, as well as social, ecological, animal welfare, and economic harms of this industrial model of animal production. Some of our center's research at the Johns Hopkins Center for a Livable Future focuses on understanding the transmission of air pollution, heavy metals, viruses, and bacteria, including antibiotic-resistant strains of bacteria, from these operations to workers in nearby communities. You might be wondering, where does antibiotic resistance come in? Well, low levels of antibiotics are fed to animals to make them gain weight faster and on less feed. In fact, about 80% of antibiotics used in the US today are administered not to humans, but to food-producing animals. I don't have to convince most of you that the non-medical use of antibiotics in livestock production is eroding the effectiveness of life-saving drugs. Next slide. Okay, so what about eating local foods, which are often touted as a solution to climate change? Well, in the previous figures I was showing you, only looked at the production side of the food chain. If you also consider the greenhouse gas emissions required to transport food, you'll see that the production process contributes a much larger share, about 83%, compared to transportation emissions, which contribute about 11%. So the types of foods in our diets have a much greater impact on reducing greenhouse gas emissions than how far the food has traveled from farm to plate. Next slide. So we've talked about how more climate-friendly food choices influence public health at a broad level. How do they affect the individual health of consumers? Well, in general, most of the foods with the lowest greenhouse gas footprints are also associated with reduced risk for chronic diseases, especially fruits, vegetables, nuts and seeds, and whole grains. At the same time, some of the foods with the highest climate impacts are also less healthy. The strongest evidence is for cutting processed meats, such as bacon and sausage, and red meat, such as beef, pork, and lamb, because they're associated with increased risk for diabetes, colorectal cancer, and in the case of processed meats, coronary heart disease. There are some nuances here, such as the fact that all seafood is not the same. From a sustainability and health perspective, it's best to focus on fish low on the food chain, because they can have many of the same omega-3 benefits that associate with other oily fish, and they contribute less to overfishing and greenhouse gas emissions. Next slide. Before concluding, I want to recognize how food systems climate solutions can be more equitable. This map shows the 10 countries with the highest per capita meat intake. We shouldn't be asking people to reduce their intake of meat in places with high malnutrition and stunting. We should be focusing on countries with the highest meat intake and therefore the greatest opportunities for footprint reductions. And even within countries with high meat intake, consumers have differing abilities to eat healthy and climate-friendly foods. While lentils are very nutritious, affordable, and have the lowest greenhouse gas footprints, lentils and beans, I should say, the lowest greenhouse gas footprints among protein foods, they may require longer amounts of time to cook and a learning curve to learning how to cook them and make them taste delicious. Other climate-friendly foods, such as meat or dairy replacements, can be more expensive than the items that they're intended to replace. It's also much harder to eat healthy, climate-friendly meals if they're not easily available and accessible to you. Next slide. And that's where we can now turn to promising policy solutions to address food systems emissions. A growing number of efforts are focusing on changing what food is available at hospitals, schools, and other institutions through changing the procurement policies. These policies may be set by individual institutions, municipal and state governments, and even by the Department of Defense, which has a great deal of control over purchasing for schools, prisons, and vendors in federal buildings. A relatively simple but effective approach is to make more healthy and plant-forward meals available to consumers. It's not about limiting choice or banning or restricting options, but actually giving consumers more choices that also align with health and climate benefits. Efforts are also underway to source ingredients from more sustainable producers, to reduce the portion of meat in meals when meat is offered, and to track and reduce wasted food. Next, please. And speaker to the broader health and climate concerns associated with industrial food animal production, policy advocates working at both the state and federal level have been working to increase regulation around air pollution, antibiotic use, manure and waste management, and even to place moratoria on the creation of new industrial livestock operations. And lastly, at the federal level, there have been efforts to align our dietary guidelines with sustainability goals and to support more independent research into plant-based alternatives and lower emissions livestock production. And lastly, I encourage you to check out these links for more details on specific policy recommendations that are being proposed related to the different solutions I mentioned. I'll include those links in the chat box after the presentation. Thank you.
Raychel, thanks so much for that. You really, that was a meaty presentation. Yeah, no, that was fantastic. So our last speaker, Howie Frumkin, take it away, Howie, to talk about nature, health, and climate change.
Jonathan, thank you very much, and good afternoon, everybody. I'm here to talk about the great outdoors, and ordinarily on a beautiful Seattle Saturday afternoon, that's where I would be, but this has been such a good meeting that I'm actually glad to be indoors Zooming for the afternoon, and hope you all are too. Well, I'm going to talk about the health and climate benefits of nature. The idea that nature contact may benefit health has a long history. Next, Colin. For example, we missed a slide there, Colin. Can you go up? I guess the slide got dropped out. The environmental health field has, for the longest time, focused on hazardous exposures, on asbestos leading to lung cancer, on endocrine disruptors interfering with child development, with climate change and all the things that we know that it does. But in the context of today's discussion, next, Colin, there's a happier kind of association, and that's that nature contact can lead to health benefits. Next. Nature contact offers a remarkably wide range of health benefits. The ones that you see here are kind of intuitive. They relate to stress reduction and psychological well-being and include a lot of behavioral benefits. Next. But what might be surprising is how many benefits are somatic, from lower blood pressure to better birth outcomes to better immune function. In some cases, the mechanisms are clear. For example, green space promotes physical activity, but other mechanisms are not yet well understood. Next. The benefits of nature have led to a wide popular literature. You've seen a lot of books in the upper part of this panel. And these benefits have also led to a whole range of public initiatives. The NGOs such as Park Prescriptions America and Children in Nature Network, and park system initiatives like the Healthy Parks, Healthy People initiative at the national parks. Next. Diversity and equity are critical considerations in this field for several reasons. First, there are disparities in nature access. Poor people and people of color are disproportionately likely not to have access to safe, attractive, well-maintained green space. Next. Second, as any park superintendent knows, there are cultural differences in how people interact with nature. Baseball versus soccer, picnicking versus hiking, differences that are highly germane to understanding how benefits operate and how to deliver these benefits. Next. Third, intriguingly, there is some evidence that nature contact brings disproportionate benefits to vulnerable populations, including people of lower socioeconomic status, suggesting that nature contact may help to blunt health disparities. Next. And finally, there's growing evidence that greening neighborhoods that are relatively deprived of nature, on the face of it, a good idea, may have the unintended consequence of driving up real estate values and displacing the people who live there, a phenomenon called green gentrification. We need to understand this and devise policies that will prevent it. Next. Now, nature contact occurs across a spectrum, as shown here, from the relatively small scale, brief, and incidental, like potted plants in a room, to the relatively large-scale, longer-term, intensive, even immersive experiences such as wilderness adventures. And this spectrum doesn't begin to capture the varieties of nature contact, the sensory modes at play, smell, taste, feel, as well as sight, the cultural filters people bring to bear, and so on. Next. So let's link this all to the theme of today's meeting, climate change. Where do health and climate intersect with respect to nature? Well, I'm going to discuss three venues: urban parks and green space, land conservation, and nature-based solutions. Next. At the urban scale, parks and green space offer a range of health benefits. They go from physical activity to mental health promotion to noise control, as you see on the upper part of this slide. Excuse me. There are also climate benefits, adaptation, such as reducing the urban heat island, and mitigation, such as reducing energy demand and the need for electricity. Next. At the larger scale of rural land stewardship also delivers both health and climate benefits, often conceptualized as ecosystem services: healthy food, clean water, carbon sequestration. Next. Finally, nature-based solutions are strategies at various spatial scales that address a range of societal challenges through tending natural ecosystems, wisely managing working ecosystems, as we just heard about, and creating novel ecosystems. Next. Nature-based solutions, when focused on climate change, are referred to as natural climate solutions. The Nature Conservancy definition I'm showing you here focuses on landscape and wetland management. Intact land stores a lot of carbon, both in soil and in plants. The graph I'm showing you here shows the climate mitigation potential of various strategies. The top bars, which represent reforestation and good forest stewardship, are by far the biggest contributors, but agricultural practices and grassland management play a large role, and so does wetland stewardship. Together, according to this analysis from PNAS, these practices have enormous potential, enough to achieve over 1/3 of the needed mitigation to keep us on a 2-degree path. But this analysis doesn't even consider all possible natural climate solutions. Next. Let me work the example of mangrove forests. Now, depending on where you live, you might not think these are very common or important. Next. But mangroves are widely distributed across a swath from Florida to Texas. And globally, they're very common. So if they offer health and climate benefits, that matters. Next. One thing mangroves do is provide flood protection, as shown in this schematic. When the floods come, you'd much rather live in the upper panel, where the mangroves blunt the impact of arriving water and preserve the buildings, than in the lower panel. Next. And mangroves provide flood protection in some of the most populated flood-ravaged parts of the world, so very useful. Next. Beyond flood protection, mangroves offer lots of health benefits, both directly through nutrition and medications, and indirectly. Next. And mangroves are hugely effective in sequestering carbon. So there it is, a natural climate solution that's good for health, and only one of many examples. Next. At the more localized scale of cities, natural climate solutions include parks such as this one in China, which offers stormwater management, flood protection, nature contact for the city's residents. All good things. Next. Same with this tidal marsh and constructed wetland in New York. Next. Same with this 11-acre park in Bangkok, a nature-based supplement to the city's overloaded drainage system and a beautiful amenity in a very urbanized place. Next. And same with this street-level combination of local vegetation and stormwater retention, which can be found in cities across this country and globally. Next. So what are the policy implications? Well, at the federal level, the health and climate benefits show up in the administration's infrastructure plan, in the so-called 30 by 30 initiative that's conserving 30% of the nation's land and water by 2030, and in the president's recently released budget proposal with provisions such as the new CCC, the Civilian Climate Corps, So these initiatives deserve our support. Next. They also show up in executive orders and in proposed legislation. In particular, I'd flag that the Great American Outdoors Act authorizes funding for the $12 billion backlog of maintenance in the nation's national parks. That deserves our support. Next. At the state and local level, take a look at the American Society of Civil Engineers report card for this year. Next. If we look at the public parks score, the nation gets a pitiful D+. Next, and the deferred maintenance of state and local parks is 5 times larger than that in national parks. So this needs attention. Next. So at the state and local level, when we want to support health and climate solutions, we can support park funding. We can support greening our cities. We can support coastal management, and we can support urban agriculture. Next. So in summary, I've made the point that Nature Contact offers a wide range of health benefits, which are inequitably distributed. And as we advance those benefits, we need both to attend to optimizing health benefits and also to optimizing them equitably. Nature Contact occurs across a range of settings and spatial scales, offering many opportunities for us to make a difference. They arise in urban parks and green space and land conservation and in nature-based solutions. And there are levers we could be pulling and should be pulling both federally and at the state and local level. Thanks very much.
Wow. Great talk, Howie and Ellen and Rachel. Wonderful panel. While I wait for questions to come in, I'm going to ask each of you one question. And then I have a question for Mona, because we have the breakout rooms. What time do we have to wrap up, or are we already over time?
Yeah, I think, we're really already over time, and we wanted to give people a chance to speak to each other.
How about
what they can do.
How
to
about one
advance
quick
these
question
solutions.
each, and they get 30 seconds? How about that?
Okay, sure enough.
So for Ellen, a question about gas stoves, because gas, for heating, is much more efficient than electricity. Are you taking into consideration the total life cycle with our grid providing electricity? That's for you. Rachel, any consideration of the environmental co-benefits from getting away from meat and the CAFOs, especially considering water quality and terrible water pollution from CAFOs? And Howie, I'm wondering, is there any coordination across parks departments and state or local Department of Transportation to sort of have, optimization with planning? So start with Ellen, and you get 30 seconds each.
Not sure I totally got the question, but I would say gas is not more efficient. And if we're going to meet our climate solutions, we have to get off gas. It's, there's just no choice in that. So and someone lobbed into the chat. I'll take my 30 seconds. California is considering bans on new gas stove hookups and gas hookups in buildings. And if people are in California, they should weigh in on that. State docket would be very important. Resiliency. So I think that's all I'm really going to say. We have to electrify.
That's great. Thanks, Ellen. Rachel?
Yes, so there would be numerous benefits, not just to water quality, but also to air quality around CAFOs or concentrated animal feeding operations. We know many of the people who live in communities near these operations suffer poor health in numerous ways, but one of the ways with water quality in particular is that if you've heard of manure lagoons, it's these giant pits of where animal waste is kept. And in some cases, the amount of waste is as large as a whole city, the amount that a whole city of people would produce. And they're in one area. And so when we have large hurricanes, which are unfortunately becoming increasingly common, that often makes the lagoons break or overflow and goes into local waterways and contaminates water. So yes, there are many benefits to reducing our reliance on CAFOs.
Thanks. Howie, you get the last word, and then we move to breakouts.
Transportation and nature context. So 2 quick things to say. Urban transit systems ought to be about arranging transit routes so that people can easily get to parks by transit. And many of the systems are doing that more and more. But secondly, some of the best nature contact exists outside cities at large peri-urban or rural parks. And transit systems can and should also provide bus service so people can get from cities all the way out to where the big parks are. I'm proud to say that here in King County, where you already heard about our asthma-free homes, we also were doing that as part of our transit system. And that is especially important, both of those, at addressing equity concerns when it comes to who gets access to nature. Good transportation planning can help solve that problem.
Wonderful. Thank you. And thanks for the wonderful, all the talks, great panel.